Knock, knock.
Hi.
Hello, I'm Joseph. I'm going to be doing your assessment today. How are you?
Good. How are you?
Good. Good to see you. So tell me your full name and your date of birth.
Faith Mitchell, 11/24/56.
Okay, Miss Mitchell, do you have a preference on what you would like me to call you?
Faith.
Faith. Okay. So tell me what brings you into the office today.
Recently moved here. I need a new healthcare provider.
Okay. I think we can do that for you. Are you allergic? First of all, are you allergic to any latex?
Mm-hmm.
Do you have any allergies to medicines? Okay. And do you have any allergy to dust or mold? Okay. Any other allergies that you might know of that are outside allergies? Okay. So what we're going to do is focus on your neuro. We'll do a full neuro assessment. We're going to look at your cranial nerves, make sure your sense of smell, your hearing is intact, gag reflex, which is not the most comfortable, but for most patients. And then I'll get you to get up and walk. I'll look at your balance. We'll also look at some things like being able to keep your eyes closed and feel for familiar objects and be able to identify those.
Okay.
Does that sound okay?
Mm-hmm.
Okay. Excuse me. So the first thing we're going to do is we're going to get you to close your eyes and I'll test your nares for patency. Go ahead and blow out for me. Okay, go ahead and blow out for me. Okay. Keep your eyes closed. Don't open them. And we'll get you to take a big whiff. Tell me what you smell.
Vanilla.
Okay. And do it again.
Vanilla.
Okay. And excuse me. We're going to get you to read a chart here in just a moment. If you'll go ahead and cover one of your eyes and tell me how many fingers you see me holding up.
2, 2, 2, 3.
Okay. If you'll cover the other eye for me.
2, 3, 2, 2.
Okay. Thank you very much. Guys, because this ceiling chart on the bottom, it instructs me to hold it 6 feet from the patient and have them read the smallest line. That's exactly what I'm going to do. Typically, a larger ceiling chart you would do 20 feet from the patient. And this is approximately 6 feet. I know I'm outside the camera. Can you cover one of your eyes and tell me the smallest line that you can read?
LOPD.
Okay, and then cover the other eye and tell me what line you can read.
LOPD.
Okay, so according to this chart, she is 20/40, which is that she can read at 20 feet what someone at 40 feet can read. We're going to move on to cranial nerve 3, the ocumotor. And we're also going to look at cranial nerve 4, the trochlear. We're also going to look at cranial nerve 6, the abducens with the cardinal field of gaze. If you'll do me a favor, and look right here at the tip of my nose, and I want you to follow this pin light, okay? Just the pin light, don't move your head, okay? We're just looking for any kind of nystagmus or any type of jumping of the eyes. If you'll go ahead, let me turn the lights down. I'm going to have to step out of the camera. Okay, and pick a spot on the wall there for me and look off. Okay, I'm going to shine a little light in one of your eyes here. I'm going to look for pupillary constriction in both eyes, which that happens. That happens in both eyes. So your cranial nerve 3 is intact. If you will, let's turn the light on. And we'll get you to do that one more time. Look far off for me. And just follow this pin. Look right here at the tip of the nose and follow the pin light. Just follow the pin light down there. There we go. And we have convergence and accommodation. Now we're going to do cranial nerve 5, which is the trigeminal. If you'll do me a favor and just bite down, okay? And bite down again. The masseter muscle is intact. The trigeminal muscle is intact as well. So cranial nerve 5 is intact. If you'll do me a favor and try to open up your mouth. There you go. Now push against me. With just your mouth. Okay. And then I'm gonna keep your eyes closed and just tell me if, where I touch your face. It's say right or left.
Right. Left.
Okay.
Left.
Now, if you'll do me a favor and open your eyes up, raise your eyebrows, and then relax your eyebrows, and then raise them again. There you go. This is testing for the facial nerve, which is cranial nerve 7. Go ahead and open your eyes, and then squint your eyes, and then open your eyes again. Smile, blow your mouth out, and then frown. So cranial nerve 7 is actually intact. Next, we're going to do cranial nerve 8. I'm just going to put my finger in here. I'm going to whisper a word, and I want you to be able to tell me what they are, okay?
Rabbit. Rabbit.
Okay. And then we're going to do the Ryan test and the Weber test. You should be able to hear. Air conduction should be at least twice as long as bone conduction. I'm going to set a timer here for 30 seconds. You tell me when you can't hear this anymore.
Okay.
Okay. And tell me when you can't hear this anymore.
Okay.
Okay. And so the air to bone conduction is 2-to-1. And I'll tell you what, do you hear this equally on both sides?
Yes.
Okay. Now we're going to test for cranial nerve 9, which is the glossopharyngeal. You open up your mouth. Open up. We're going to put a little thing back here to the back of your throat, and we'll get you to say ah. Okay, and then we're going to do cranial nerve 10, which is the vagus, which assesses for gag and the swallow. Let's stick this to the back of your throat. It's not going to feel that great, okay? Okay, so that's a positive gag reflex. Cranial nerve 10, the vagus nerve, is intact. And can you say A-E-I-O-U?
A-E-I-O-U.
And since her swallow and her enunciation is in line, she's not having any hoarseness. We're going to assess for cranial nerve 11, which is the accessory. You can go ahead and try to shrug your shoulders and keep pushing it down, and then push your head against mine and keep me from pushing it, and keep me from pushing your head. And so that one is intact. If you'll do me a favor and stick your tongue out for me, and then move it from side to side for me. And the hypoglossal cranial nerve 12 is intact. Next, we're going to move on to, I'm going to get you to stand up. I'm going to get you to just walk this way, and I'll get you to walk back. Her posture is upright. Her feet, there's a nice stride. She's an even stride, one foot in front of the other. Her arms actually swing out appropriately, and they're right by her side. Her head is in midline. May I see one of your hands for just a moment? I'm going to get you to tell me if you can feel this. I want to put this over your joint.
Yes.
Okay?
Yes.
Okay.
Yes.
Okay. And we'll try it on this side.
Yes. Yes.
Okay. Close your eyes for me, and I want you to tell me if I'm moving your finger up or down.
Up. Down. Up.
Okay. Keep your eyes closed and tell me if I'm moving your finger up or down.
Down. up, down.
Keep your eyes closed. We're going to do what's called 2-point discrimination. I'm going to touch you on your body. Touch you on your body, and you tell me if it's 1 point or if it's 2.
1, 2, 1, 2, 2.
Okay. Hold your hand out for me. I'm going to get you to identify. Just put this one down. I'm going to get you to identify. I'm going to put some things in your hand. Keep your eyes closed for me, okay? And then I'm going to get you to tell me if you can feel that and tell me what that is.
1.
Okay. Tell me what this is.
A safety pin.
And tell me what that is.
Key.
Okay. You're going to hand me this hand, and we'll do the same thing. Keep your eyes closed, okay?
Key.
Okay.
Coin.
All right. Last object.
Safety pin.
Okay. Now, put your hands on your knees and flip them as fast as you can. All right. Now, the same thing with your foot, both sides. All right. Now, I want you to do me a favor and stand up. And I want you to keep your eyes closed for me. Put your hands over your chest, and I'm going to attempt to make you fall over, but I promise to catch you, okay?
Okay.
All right. So this is a negative Romberg test. She's able to maintain. You go ahead and have a seat. Let me see your hands one more time. I'm going to draw some shapes in your hands, and you tell me what they are.
X. 0.
Okay. So that's that would be a negative test, and let's see. Abdominal reflexes may be a little hard for me to get to since she's standing up, sitting down. And those are positive. She is pulling back her muscles to that. I'm going to go ahead and check some of your reflexes, deep tendon reflexes. And that's positive for the bicep, positive for the tricep. Basically, it's 2 plus. 2 plus brachiocephalic, brachioradial. Let's see, patellar. Let me get in here. That's positive. I'm going to check for the Achilles tendon, which is positive, and then we're going to check for ankle clonus. And if I do this correctly, she shouldn't have any repetitive jerking on the dorsiflexion, and she doesn't. Let's check your plantar flexion. Now she's sensitive, so let's see how this works. Yep, that's definitely intact. All right, now I'm going to do one last thing. I want you to tell me where I touch you on your body, okay? Just say that it's right or left.
Right. Left. Right. Left. Right. Left.
All right. I think that concludes